video, I'll talk about syncope in the dental office and what procedures you should take if your patient experiences syncope. Syncope is defined as a transient loss of consciousness, which is due to reduced cerebral flow. Syncope results in spontaneous recovery, which means that almost as soon as the episode has begun, it will usually end on its own. Essentially, the patient passes out temporarily. Now, this is a board alert. Syncope is the #1 dental office emergency. Syncope is the #1 dental office emergency. In a young adult, it's usually caused by anxiety or pain, which stimulates the autonomic fight or flight response. The initial adrenergic response to a stressor is followed by an overwhelming cholinergic surge just prior to unconsciousness. Syncope in patients over 50 years of age can be due to secondary systemic issues like dysrhythmia, postural hypotension, hypoglycemia, or cerebral vascular insufficiency. A patient who's about to experience syncope may become very pale, sweaty, nauseous, and anxious. Their pupils will dilate, blood pressure will drop, and the heart rate will drop, which results in a loss of consciousness as the brain becomes hypoxic. When a patient experiences syncope, the dental hygienist should place the patient in a Trendelenburg position. Lower the head slightly and elevate the legs. Because syncope is a transient issue, airway, breathing, and circulation are usually not compromised, but they should be monitored. The patient should receive oxygen at a flow rate of 5 to 6 liters per minute, or if the unconsciousness persists, aromatic ammonia should be placed under the nostrils. A cold compress can be applied to the forehead. And you should ensure that the vital signs are monitored.